Below are 50 MCQs with answers and one-sentence explanations covering skin, eye, nose, tongue, and nursing applications implications. Number 50 MCQs, sensory organs with answers and one-sentence explanations. Skin, structure, and nursing applications. 1. The outermost layer of the skin is the A. dermis, B. hypodermis, C. epidermis, D. subcutaneous layer. Explanation. The epidermis forms the outer protective barrier. 2. Melanin is produced by A. keratinocytes, B. fibroblasts, C. melanocytes, D. Merkel cells. Answer C. Explanation. Melanocytes create melanin to protect against UV radiation. 3. Which layer contains blood vessels and nerve endings? A. Epidermis, B. Dermis, C. Stratum corneum, D. Stratum lucidum. Answer B. Explanation. The dermis is vascular and innervated. 4. The primary protein in the epidermis is A. collagen, B. elastin, C. keratin, D. melanin. Answer C. Explanation. Keratin strengthens and waterproofs the skin. 5. Pressure ulcers most commonly occur in areas of A. high moisture, B. high nerve density, C. low blood supply, D. thick epidermis. Answer C. Explanation. Poor perfusion increases ulcer risk. 6. The sweat glands responsible for thermoregulation are A. apocrine, B. sebaceous, C. eccrine, D. ceruminous. Explanation. Eccrine glands produce watery sweat for cooling. 7. Inflammation of the skin is known as A. dermatitis, B. cellulitis, C. psoriasis, D. eczema. Answeration. Itis indicates inflammation. 8. When assessing skin turgor, a nurse checks for A. dehydration, B. edema, C. cyanosis, D. jaundice. Answer A. Explanation. Poor turgor indicates fluid deficit. 9. The skin structure responsible for touch sensation. A. Pacinian corpuscles, B. Meissner's corpuscles, C. Ruffini endings, D. free nerve endings. Explanation. Meissner's receptors detect light touch. 10. A patient with jaundice shows yellowing due to buildup of A. melanin, B. hemoglobin, C. bilirubin, D. Carotene. Answer C. Explanation. Bilirubin accumulation causes yellow discoloration. Eye structure and nursing applications. 11. The transparent front part of the eye is the A. lens, B. cornea, C. retina, D. iris. B. Explanation. The cornea refracts light entering the eye. 12. The colored part of the eye is the A. sclera, B. lens, C. retina, D. iris. Answer D. Explanation. The iris controls pupil size and eye color. 13. Which structure converts light into nerve impulses? A. retina, B. lens, C. pupil, D. cornea. Answer A. Explanation. The retina contains photoreceptors. 14. The optic nerve exits the eye at the A. macula, B. fovea, C. optic disc, D. scleral canal. Explanation. The optic disc is the blind spot. 15. Aqueous humor is found in the A. vitreous chamber, B. anterior chamber, C. retina, lens. Explanation. It fills the anterior and posterior chambers. 16. Glaucoma is primarily caused by A. retinal detachment, B. increased intraocular pressure, C. lens opacity, D. corneal damage. Answer B. Explanation. High IOP damages optic nerve fibers. 17. The lens becomes cloudy in A. glaucoma, B. cataract, C. myopia, hyperopia. Answer B. Explanation. Cataracts are characterized by lens opacity. 18. The nurse checks pupillary reflex using A. pen light, B. Snellen chart, C. ophthalmoscope, D. tonometry. Answer. Explanation. Light triggers constriction of the pupils. 19. The area of sharpest vision is the A. optic disc, B. fovea centralis, C. ciliary body, D. choroid. Answer B. Explanation. The fovea has the highest concentration of cones. 20. Conjunctivitis affects which structure? A. iris, B. lens, C. outer membrane of the eye, D. retina. Explanation. Conjunctiva inflammation causes redness and discharge. Ear. Structure and nursing applications. 21. The external auditory canal ends at A. cochlea, B. tympanic membrane, C. stapes, D. oval window. Explanation. The tympanic membrane separates outer and middle ear. 22. Which ossicle is first to vibrate? A. stapes, B. incus, C. malleus, D. cochlea. Answer. Explanation. The malleus receives vibrations from the eardrum. 23. The cochlea is responsible for A. balance, B. hearing, C. earwax production, D. pressure regulation. Explanation. The cochlea converts sound waves into impulses. 24. The semicircular canals detect light, B. sound, C. linear acceleration, D. rotational movement. Answer. Explanation. They sense rotational balance. 25. Cerumen is secreted by A. sebaceous glands, B. ceruminous glands, C. sweat glands, D. endolymph glands. B. Explanation. Ceruminous glands produce earwax. 26. Otitis media affects the A. outer ear, B. middle ear, C. inner ear, D. auditory cortex. Answer B. Explanation. Middle ear infection commonly follows colds. 27. The eustachian tube connects the middle ear to the A. nose, B. nasopharynx, C. throat, D. larynx. Answer. Explanation. It equalizes ear pressure through the nasopharynx. 28. Conductive hearing loss occurs when A. The cochlea is damaged, B. Auditory nerve is damaged, C. Sound fails to reach inner ear, D. Brain cannot process sound. Answer C. Explanation. Blockage or ossicle issues cause conduction problems. 29. Vertigo is commonly associated with A. Cochlear damage, B. Vestibular dysfunction, C. Otitis externa, earwax. Answer B. Explanation. Vestibular system disturbances cause dizziness. 30. Rennie test compares sound heard via air versus bone conduction, B. Left versus right ear, C. High versus low frequencies, D. Loud versus soft sounds. Answer A. Explanation. It assesses conductive hearing loss. Nose, structure, and nursing applications. 31. The nasal septum divides the nose into A. 4 chambers, B. 2 nasal cavities, C. Sinus openings, D. Olfactory bulbs. Answer B. Explanation. The septum separates left and right passages. 32. Smell receptors are located in the A. Nasal vestibule, B. Olfactory epithelium, C. Turbinates, D. Nasal mucosa. Explanation. Olfactory epithelium contains sensory neurons. 33. Turbinates function to A. Produce mucus, B. Warm, humidify, filter air, C. Create odor molecules, D. Prevent drainage. Answer. Explanation. Turbinates help condition inhaled air. 34. The sense of smell contributes significantly to A. Sight, B. Taste, C. Touch, D. Hearing. Answer B. Explanation. Smell enhances flavor perception. 35. Epistaxis refers to A. Nasal polyp, B. Nosebleed, C. Sinus infection, D. Nasal obstruction. Answer B. Explanation. Epistaxis is bleeding from the nasal mucosa. 36. Sinusitis is inflammation of the A. Nasal septum, B. Paranasal sinuses, C. Olfactory bulb, D. Nasal vestibule. Explanation. Sinuses become swollen and blocked. 37. Loss of smell is known as A. Dysphagia, B. Anosmia, C. Adjusia, aphasia. Answer B. Explanation. Anosmia refers to absent olfaction. 38. Nasal cannula delivers oxygen through the A. Trachea, B. Nasal passages, C. Throat, D. Mouth. Answer. Explanation. It supplies low-flow oxygen via the nares. 39. The primary nursing concern for a patient with nasal fracture is A. Bleeding, C. Airway patency, D. Cosmetic deformity. Answer C. Explanation. Maintaining airway is priority to prevent obstruction. 40. Allergic rhinitis is caused by A. Bacteria, B. Virus, C. Allergens, D. Hormones. Answers Nation. Histamine release triggers nasal reactions. Structure and nursing applications. 41. Taste buds are located in the A. Lingual frenulum, B. Papillae, C. Tonsils, D. Answer B. Explanation. Papillae contain sensory taste receptors. 42. The taste sensation for sweetness is detected mostly at the A. Tip of tongue, B. Side, C. Back, D. Entire surface. Equally. Answer A. Explanation. Sweet receptors are abundant on the tip. 43. Umami taste is triggered by A. Salt, B. Sugar, C. Glutamate, D. Acids. Answers. Explanation. Glutamate provides savory flavor. 44. Glossitis refers to A. Salivary gland swelling, B. Tongue inflammation, C. Loss of taste, D. Hard palate infection. Answer B. Explanation. Glosso means tongue, itis, indicates inflammation. 45. Dysphagia means difficulty in A. Speaking, B. Swallowing, C. Breathing, D. Smelling. Answer B. Explanation. Dysphagia often relates to tongue and throat issues. 46. The cranial nerve responsible for most taste sensation is A. CNV, B. CN7, D. CNX7. Answer C. Explanation. Facial nerve transmits anterior tongue taste. 47. Poor oral hygiene primarily affects A. Smell, B. Taste, C. Vision. Answer B. Explanation. Coated tongue reduces taste sensitivity. 48. Dry mouth, xerostomia, decreases taste because A. Enzymes are absent, B. No moisture dissolves chemicals, C. Nerves are damaged, D. Tongue shrinks. Answer B. Explanation. Saliva is needed to dissolve taste molecules. 49. The nurse assesses the tongue for A. Color, moisture, lesions, B. Pupil reflex, C. Earwax odor, D. Skin temperature. Answer. Explanation. Tongue appearance can indicate systemic disease. 50. A major nursing concern for a patient with tongue swelling is A. Pain, B. Dehydration, C. Airway obstruction, D. Difficulty speaking. Answer C. Explanation. Swelling may block the airway, making it an emergency. Thank you. Have a nice day.